Good afternoon. Today I didn't intend or plan to be up front here, but by chance I've been told to be here due to some inconveniences somewhere. I'm not a pulpit person, I'm a backbencher always. But for today, my main purpose to be here, I'm trying to look at today's topic. It is supposed to be a health message for everybody, and I'm trying to get today's what they intended for us to learn today. It is something that is common, especially at this period of time that is affecting most of the people around. And before I continue, my name is Brian Machuki. So the topic of today was or is still seasonal influenza. Most of you have gone through a phase of influenza or still going through the same currently, and or you don't know what you're suffering from. And today we are trying to understand influenza as an infection. Influenza affects most people in every part, every age. And what is influenza? It might come as a big name for everybody, but it might not be that big, or it might be. So influenza, as we see it, is a respiratory tract infection. It affects your respiratory system. That is from your nose going to your lungs and everything involved. And the seasonal influenza that they had picked specifically, it is an acute infection that attacks the respiratory system, and it is called by a virus, which is called influenza, the influenza virus. And most of the time tend that nasikia niko na sore throat, utakuja hospitali pale utuambie nasikia naumwa na koo, nimechoka, makamasi, nataka madawa. But does that medication you come seeking for really help? Does it? Anybody who has an answer for me who can tell me if it helps or not? Most of the time it doesn't heal that influenza that you're having, if it is influenza that you're suffering from. Because influenza is a viral infection. And most virus, we don't have medication for them as we talk. Everybody knows the only virus they know that doesn't have infection is HIV/AIDS. But there are other viruses like influenza. When you're having a common cold and you say it is a flu, that is caused by influenza. What are the signs that most people present with when they have influenza? You'll have sore throat, running nose, headache, fatigue, that you feel tired. You just feel tired and you haven't done anything. You'll still be complaining, I've just spent the entire days doing some simple tasks, but you're feeling so tired as if you've dug an acre of land. Some people will have even joint pains or pain. Your entire body will be having aches. You can't specifically say it is just my feet or anywhere. You have body aches. When you come, you'll go to the facility. Most of them, they'll tell you, let's take your blood sample. We do a full hemogram. We do a malaria test, being in Kenya, because most places in Kenya most people suffer from malaria and there's no malaria. When we look at your blood works, we see the red blood cells, how they are behaving, and white blood cells, we know there's an infection, but it doesn't tell us specifically what infection it is. So from there, it is mostly diagnosed clinically from what you present with. What you come with is what is used to diagnose your influenza infection. And how is it spread? The influenza infection. It is spread by one individual having the influenza, then he coughs or sneezes without putting hygienic mannerism. That is why during the COVID pandemic, we were being told, use masks, wash your hands, all those measures. Those are measures that we need to be applying on a daily basis. Apart from the mask a bit, it is extreme, But the rest you need to apply them to prevent most of the infections. Like the influenza, it is airborne. When somebody sneezes or coughs to the air and is suffering from influenza, the droplets, the influenza droplets remain in the air. Then they'll be transferred from one individual to another. And that is how you'll get that infection. So hygiene and proper cough mannerism are main part of prevention of influenza and other respiratory infections. Although influenza itself, it is categorized into 4. We have influenza A, B, and C, up to D. Although D is more found in animals, but nowadays with the bit gene mutations here and there, these first world countries are using the common infections as weapons. So you might get a gene mutation that you get even influenza D affecting individuals. The common influenza A is the H1N1 virus, which was a pandemic around 2009, which affected most countries. So those are the common influenza viruses that are there. So currently we have influenza vaccine that is most individuals are advised to get. For medics around here, they know we are not even advised. It is like a mandatory thing. You are hijacked at your workplace, you're told, oh, bro, bado kwa list hujaonekana, you get your job and you continue. It is not a question if I want, you have to. Because you are predisposed and you are at an environment that you can easily get this infection from the people you interact with. Because the caregivers, the health workers are the first contact for any person, even if those who are having influenza, who are having any infection. And there are people, influenza itself, it is not so severe. It can't go to the extreme of killing, but there are individuals, categories that who are told the moment you get an influenza infection or symptoms, you need medical assistance as fast as possible. These are the children under the age of 5, pregnant mothers, anybody suffering from any chronic illness that is from diabetes, hypertension, cancer, HIV infection, any infection that is chronic long-term, or your immune is compromised, like those who are going through chemotherapy and such. The chemo patients, most of them, the immunity is severely compromised. Anything, any infection can go with them. So you are advised to seek medical assistance at any time, because for those ones, it can lead to death. Anytime. Influenza, as simple as you say, ni homa tu. But for those category of people, they need to get medical assistance. But every individual in the entire population, they are advised, and most important, that category, they are advised to take an influenza vaccine at least annually to prevent influenza from getting into them, because they are at risk of getting it, the severe form of it. So from now on, we can get to know how we can handle ourselves so that we can prevent such infections. From getting it and spreading it to the rest, let's care about the rest. If I'm having a flu, a cough, how am I behaving when I'm with other people? So let's be each other's keeper. Let's have a proper hygiene and proper cough mannerism so that we prevent these common and basic infections like influenza. For today, I was told that was the main topic that I was to handle. Even if I wasn't prepared, I was just ambushed like 20 minutes ago. I was told, oh, excuse, somebody who was to present didn't come in. Can you just step in? So I said, it is a common knowledge thing for us. Let me do it. And thank you for listening to me. Anybody with any question regarding to influenza can ask before I sit down. Any? Seems there isn't any. Yes, please. Thank you.
Thank you for taking us through that. My question is, is even cough taken to be an influenza, that it has no medicine? Cough, not flu.
Thank you for that question. Cough is not an infection, it is a symptom. Cough itself is not an infection. It is a symptom of something else. By the time you're coughing, there's an irritation in your respiratory system or your gut. There's something that has triggered. There's a trigger. So that trigger makes you cough, but what is the cause of the trigger? There's an underlying condition. It is just a symptom. So even for those others that we will go to the facility, or you'll go to the chemist, which is a bad manners, going to the chemist to treat yourself. You're treating yourself for what you don't know. You need to go seek a proper advice. The chemist is a shop. So for those who get to the facilities and they are given medication, most of the medication for influenza are symptomatic management. You're given, if you're saying I have joint pains, headaches and everything, you're given analgesics, painkillers to treat that pain. I'm having a running nose, antihistamines to cut that running nose. But there is no specific medication. You'll go get there and you're given painkillers and some Piriton, and you say, huyu daktari hatajui kazi anafanya. Hakunipatia antibiotics zenye napewanga. But what is the function of that antibiotic? Nothing. You're just pumping your body with other medication that are not necessary. By the time you're given antibiotics, there is need for that. So most of the time, influenza is treated symptomatically, treating the symptoms to relieve the pains and the discomfort for you to continue your normal running. Okay? Thank you for the question. Any other? Thank you. Or is influenza related to COVID? COVID was a strain of influenza. I told you influenza has subcategories. It is influenza A, B, C, and D. In influenza A itself, it has some subcategories under influenza A. That is where I told you there are gene mutations that appear. COVID was a gene mutation of influenza A. That is why you were being told it was manufactured in a lab in China and spread. There was a gene mutation. It is part of the influenza. That is why most of the people, you could get COVID and recover without any medication. But if you had an underlying condition, you could end up being hospitalized, getting supplementary oxygen for that, and all that other forms of treatment. But all those are under influenza. It is a viral. It doesn't have a specific treatment, so it is only symptomatic, okay? Yes?
Thank you for the presentation. You talked of a vaccination.
Yes.
At what stage or how do we get it? Those of us who have got this, you called them chronic?
Those who are in the risk categories.
Yes. Do I come to you and say that I want to be vaccinated, or how much does it cost? Because these days it is all about cost. Or can you organize for a medical camp here and ask those of us who are in that category to come for it, because it has disturbed me.
Okay. For the vaccination, most of you, nobody will come and force the vaccine on you like us medics. That's how they'll do for us. We are in a different ground. For you, it is you. It is your personal initiative. You need it, you go get it. So if you go to a facility, it will vary. Like if you talk to the guys from AAR there, they'll tell you they have it. The cost will vary, they'll incur cost. But if you come to the PGH up there, you might get it for free, depending. There's a time they have a campaign for it and you'll get it for free. And if there is any charge put on, it is usually very low, but they vary depending with the facility and the period of time. But it is available for everybody anytime, any facility you go to. If they don't have, they'll refer you to the facility that has. Okay? It is advised annually. Annually. Okay. Thank you for the questions. I'll hand it back to you. Thank you.